Most observational studies start with selecting a set of patients and looking at outcomes. For example, we can ask if people who take aspirin have a different risk of heart disease. But every time you select a cohort, you run the risk of selection bias. That is, that the patient set has some characteristic that biases our study results. Researchers control for the ways that they know their cohort might be different, but here we talk about an aspect of cohorts that people do not typically control for, a difference in the level of medical care associated with taking the drug. If people who take a drug systematically have a different level of medical attention, then they will have a different probability of being diagnosed with a number of conditions. This could happen if people get different drugs based on their insurance, or their wealth, or their level of illness. We develop a way to measure whether this bias can affect a cohort. We can show that, for example, patients who take more drugs take different drugs. This is a pattern related to data missing not at random. The good news is that in our experiments, we're able to account for the amount of data observed and thus break the biased association.